Hi guys, my name is Alli Reck. I am an occupational therapist. I am hoping to share with you guys a little bit today about what a career in occupational therapy looks like. Oh, I don't think let me see. So, a little bit about occupational therapy or OT. I work at St. Luke's in Cedar Rapids. Currently, I work on the Inpatient Rehab Unit. So oftentimes after a significant medical event, such as like a brain injury or a stroke or a spinal cord injury, people come to the rehab unit to get better, to kind of relearn how to do the everyday stuff you have to do. So OT is the only profession that helps people across the lifespan do the things they want and need to do through the use of everyday activities or occupations. So occupation in our profession doesn't always refer to like your job or your employment. It refers to like things that occupy your time. So OT practitioners help people live life to its fullest by promoting health, but then also helping those people that do have injury, illness, or disability live life to the fullest and increase quality of life. So one of my favorite quotes is, occupational therapy practitioners ask what matters to you, not what's the matter with you. So we look at people's strengths and see how can we use these to maximize their performance and be more independent. But then we also consider weakness and limitations and things. Think about how can we fix this, or how can we help this person compensate for those limitations or barriers. One of the great things about a career in OT is that you have the opportunity to work in a variety of different settings. You can see here a majority of OT practitioners work in a hospital setting or in long-term care, which would mean like a nursing home or assisted living. Many OT practitioners also work in a school or a clinic setting. Some people work in home health, meaning they go to their clients' homes to work with them in their house. And then other practitioners work in settings like academia, so working in like a university setting. And then others work in more community-based settings or mental health settings. Certainly this list is not comprehensive, but we help a lot of different people. Like I said, where I work on the inpatient rehab unit, we work a lot with people with these neurologic diagnoses, so people that have had strokes, brain injuries, spinal cord injuries. In the hospital setting, working with people that have had total joint replacements, or people that have fractures or have fallen, or people that have a new amputation. Within like a pediatric setting, within like a school or a clinic, you could see kids with autism spectrum disorder, kids that aren't meeting their developmental milestones, kids that have sensory processing disorder, need help with handwriting skills. Also within the hospital system, we oftentimes see people with cardiopulmonary impairments, so things like COPD, people that have had heart surgery or have a heart attack. And again, like I said, this list is not comprehensive. We also work with people that have low vision, or help people with wheelchair positioning, or in some settings, we do help people return to work. So what are occupations? Like I said, they're anything that occupy your time, any activity that's meaningful to you. So occupations are categorized into a few of the categories listed below. So activities of daily living include, I think of these as like morning routine activities. So getting dressed, going to the bathroom, showering, being able to feed yourself, brush your teeth. Instrumental activities of daily living are more of, I think of them like chores. So cooking, cleaning, doing laundry, driving, writing out your bills, taking medications, taking care of pets, taking care of children. Sleep and rest. So certainly we can help people with like sleep hygiene habits. So remember to not have screen time right before bed, or do activities like taking a bath to relax yourself, and help people think about how to position themselves in bed so that they can fall asleep and stay asleep. For kids, play is like their main occupation. That's what kids do to occupy their time. So again, for those kids that may not be meeting those developmental milestones, we're working with them through play. I mentioned earlier, occupation doesn't always mean exclusively like work or employment related, but in some instances it does. So helping people return to work or identify based on their strengths and weaknesses what employment opportunities would be appropriate for them. We also help people engage in leisure activities, engage in social participation, and if education is something that is relevant to our patient, we're working on education-related skills. So a typical day for me looks like this. From 8 to 8:30, I'm kind of looking over my schedule for the day, kind of thinking ahead, okay, if these are my patients, what do I want to do with them? From 8:30 to 9, I'm usually in a meeting with the care team, kind of reviewing the patients and saying, here's where they're at, these are the goals I have for them, this is what they still need to work on before they're ready to go. And then from 9 to noon, I'm seeing patients. For the noon hour, I'll eat my lunch and I typically start to write my notes. We have to document every session with a patient since we're billing our services to an insurance company. And then in the afternoon, I'm seeing patients again from about 1 to 3:30. And then again, at the end of the day, I have about an hour or so to document, to write my notes on the computer. I wanted to walk you guys through like an example patient to kind of see like what does that look like. So this example patient, he was a 20-year-old gentleman who had a stroke. He presented with really poor balance. He couldn't move his left arm at all. He was very distractible. He was always grabbing at things on the tabletop. He had really poor posture. He was always leaning to that left side, and he was always looking to the right. So he was always positioned like this, and it was really hard to get him to even like look forward. So what did I do with him, the OT process? So every day we worked on the morning routine. So working with him on helping him be more independent and getting himself dressed into the bathroom and brushing his teeth. We also did a lot of exercises to get that left arm moving. One of the ways that we got that left arm moving was through electrical stimulation, and I will actually show you a little video of how that works and what that looks like. I also made several modifications for him. So like, because that left arm wasn't moving like it normally would, it was really hard for him to lace up his tennis shoes. So I got him set up with some elastic laces so that he didn't have to lace up his shoe. We also got some equipment for home because his balance was so impaired. I didn't think he was going to be safe to stand up to shower. So we got him set up with a shower chair so that he could sit to shower to be able to do it on his own. We also worked on activities at a tabletop, focusing on increasing his attention span, and then also worked on visual scanning because again, he would not see things on the left side. If you gave him a menu, if he was going out to eat, if I put a menu in front of him, he wouldn't see anything on that left side. So focusing on drawing his attention, forcing him to pay attention over there. And then this young gentleman was working before he had his stroke, so returning to work was important to him. So we kind of ran through some simulated activities to, again, kind of simulate or practice what it would be like for him at work.
Okay, so I'm going to show you guys a treatment that we oftentimes do with people after a stroke. They can be significantly weak on one side of their body, their arm or their leg, because the part of their brain that's responsible for getting that arm or leg to work has been damaged by stroke, either a blood clot or a hemorrhage, like a brain bleed. So what I'm going to do is show you then what can we do then to get that arm or leg to work. one way that we can do that is by providing e-stim or electric stimulation into those muscles to kind of retrain the brain to work. So I'm going to take these electrodes and I'm going to hook them up to our patient's arm here with the hope that when I hook her up, we can get some movement at that wrist and hand and fingers. So I've got my electrodes on the muscles that I want to target, and I'm going to hook her up to my little machine here. And so I don't want you to do anything, I just want you to let the machine do the work. So it shouldn't hurt her at all, it should just feel kind of buzzy or tingly. Do you feel anything yet? Is it too much? Nope. No? Okay. So we're seeing a little bit of those fingers start to open. And you're staying totally relaxed, right? Yep. Okay. And so it goes through a cycle where it'll contract those muscles and then relax. I'm going to bring it up a little bit more. Oh, hello. Is that okay or is it too much?
No, it's good.
Okay. So like you can see, she's not doing any of this. The machine is controlling those muscles to open those fingers, lift up that hand. And then when the stimulation goes off, her muscles are going to go back to a relaxed position like that. So I also have our patient set up in front of a mirror, so you can see her right hand is on the opposite side of the mirror receiving that e-stim, but her left hand that works okay is over here on this other side. So we can set people up so that it appears to her as she's looking into the mirror that both of her arms are intact. And the way that works is there are brain cells called mirror neurons, and they react when an action is done and then when it's observed. So like with this activity, we're trying to trick her brain into thinking that her right hand that is impaired is actually working. So what I want you to try to do is, I have these blocks in front of you. I want you to stack them using your left hand, but I don't want you to look at your hand or look at the actual blocks. I only want you to do it by watching yourself in the mirror. Okay, so go ahead and give that a try. Nicely done.
So as an OT practitioner, we're collaborating with a lot of different professionals. I work really closely with physical therapists and speech therapists, but I'm also collaborating with doctors, nurses, social workers, case managers, psychologists, prosthetists, teachers, pharmacists, dietitian. I mean, the list goes on. Collaboration is really important in this career. I think as an OT, there are a lot of opportunities for growth. So certainly you can work your way up into like a supervisor or manager role. Some other OT clinicians that I know have worked into more non-traditional roles. So working as an intake coordinator to help almost kind of like recruit patients to come to a rehab center. And you can always get different certifications in like niche areas of OT. So driving and community mobility, seating and mobility, pediatrics, low vision, hand therapy. There are a lot of different certifications that I didn't list here. And all of these vary in terms of hours and cost. But certainly if you're looking to continue learning and gaining different skills, there are a lot of different certifications that you could get. Things I like about OT, I love working with people. I like that I can be a creative problem solver. I think one of the great things is that like every day is different and it's not a rote or routine like day after day, same thing. It's also an active job. I'm on my feet, I'm moving, I'm physically helping patients. And like I mentioned earlier with the certifications, there's the opportunity to keep learning. The OT profession is rooted in science and evidence. And so as new research comes out, there's always more to learn. I also like collaborating with other people in professions. So when I'm in these meetings with the interdisciplinary team or trying to work alongside the PT to problem solve, okay, how can we best help this patient? I think the job outlook is also, I don't know, an enticing thing about a career in OT. According to the Bureau of Labor Statistics, the employment need of OTs is projected to grow 18% from 2018 to 2028, which is much faster than the average rate of increase for all occupations. There are some challenges with this profession. I think the documentation is a tough one. I think any OT or therapist you ask would tell you that they would rather spend their time treating patients than writing about it, but it's a necessary piece of the job. I think oftentimes there are challenging situations or scenarios. I think it can be physically and emotionally draining. We're helping people that need a lot of physical assistance. And so I think over time that can wear on your body. And I think, again, like you spend so much time with these patients that they become very near and dear to your heart. And so it's hard to watch someone struggling. I think too, healthcare and insurance are barriers. Sometimes there have been instances where I know the patient would benefit from more therapy, but insurance won't pay for it. And so it's insurance and healthcare are just incredibly complex, which is a challenge to kind of keep up with that. An important thing I should talk about is that the schooling required to become an OT, you have a couple different options, I guess. So you could become an OT assistant or an occupation or an OT assistant or an OT. To be an assistant, it is an associate's degree, so something like Kirkwood would offer. To become an OT, you could either get a master's or a doctorate level degree. For either of those, you have to have a bachelor's degree, which is 4 years typically, and then for a master's, it's usually about 2.5 years on top of that, and for a doctorate, it's closer to 3 years on top of that. Certainly, the cost of schooling is higher for an OT degree. Earning capacity differs between an OT assistant and an OT. Certainly, estimated salary depends on what setting you're working in and what geographical location. So these are just kind of an estimate. Clinically, the main difference between an OT and an OTA or an OT assistant is that OT assistants can't evaluate patients, they can only treat them. So an OT has to be the person to meet the patient for the first time and kind of establish, what do we need to work on with this patient? What can we do with them? And what goals do we have for this patient? So the OT is more directive of the OT assistant, giving them some guidance. So an OT can evaluate and treat patients. They practice independently. The main difference between a master's and a doctorate level degree is that with the doctorate, there is an emphasis on research and academia. So I got this from the Kirkwood website. It has just kind of a rough estimate of what the cost of an OTA degree would be, which I think works out to be close to $20,000. So about my path to OT, so I graduated high school and I started college at Iowa State. I wasn't really sure what I wanted to study. I thought maybe something in healthcare. So I actually went to like a pre-health club meeting, and one of the counselors there suggested that I get my CNA, my Certified Nurse's Assistant, just to get some exposure in the healthcare field. So I did. Because I was at Iowa State, I got that through DMAC. And so throughout undergrad, I was working part-time as a CNA in a nursing home. In the meantime, during school, I was thinking maybe I want to go into advocacy of some sort. So I got my dream internship at the Iowa Department on Aging, and it was not what I thought it was going to be. While it was a very valuable experience, I didn't like that I was sitting in an office all day. I wasn't seeing the immediate ways I was impacting the community. And I found myself like really missing my part-time job as a CNA. I missed that I was at that job, that I was active and time would fly by and I had this one-on-one interaction with my patients and feeling like I was making a difference. So I started to look into OT, and I had to go take a couple extra courses as prerequisites for the graduate programs, and then started applying to OT schools. If you think you're interested in OT, I would suggest observing some type of therapy. Usually you can just call a clinic or hospital and ask to get in contact with somebody who could help you get set up to shadow. I think volunteering in a hospital or clinic setting would be great. I think getting a part-time job that is either applicable or works with the people you're interested in helping or helps build the skills you need. So my experiences that I found valuable were my work as a part-time CNA at a nursing home. I also did some volunteer work. I did dance marathon at Iowa State, and I also gave campus tours. And then I did observe a lot of outpatient hand therapy. If you're applying to grad school, a lot of times you need to have a certain amount of observation hours. And then skills that I think you would need to go into OT, I think the number one would be flexibility. A lot of times, during my morning time when I'm planning out who I'm seeing for the day and what I want to do with them, a lot of times on the spot I have to change my plan. So even though I have this beautiful idea in my head of how our session is going to go, a lot of times the patients show up and they're like, I don't want to do that today, or I have a lot of pain and so I can't do that, or I try it with them and it's way too hard or it's way too easy. So I think being able to be flexible and kind of like think on the spot is really important. And I think the critical thinking aspect of that too is very important, that I'm able to problem solve my way through it. I think social skills and communication is really important because you are collaborating with different disciplines, as well as being able to communicate to the patient what you want them to do. As an OT, I have a lot of freedom to do with my patients what I want. And so I think being able to take initiative and be productive and efficient with that time is important. But I also think, like, as an OT, you have the opportunity to be a creative problem solver, and use a little bit of creativity to design new products or think of new ways for the patient to do something that they do every day. For more information on occupational therapy, I think AOTA is a great resource. That's the Association of Occupational Therapy in America. And then ACOTE is kind of the education board. So if you're interested in finding out more about schools that have an accredited OT program, that is a good resource, and email as well. Thanks for your guys' time.